Now, you have a rather amazing thing in Peru, Plan Esperanza. That's bringing hope in cancer. It's all about cancer control. What have you done so far?
Plan Esperanza did an unprecedented change in our country for cancer control. We have now a prevention service across the whole country for the different regions in my country. But another important thing, we give access to the treatment for the poorest population by free of charge. We increase the affiliation of the public insurance from 70% to 55%, and we decrease out-of-pocket expenses from 60% to 7% in the poorest population setting.
Right, so the cost of cancer is an important issue, the cost of care. Can I ask you first of all about the prevention? What did you do what have you done so far in prevention?
In prevention, we are running different actions, promotion health, using different type of strategies like counseling, medical education, and patients education, and we call Tell Me Everything About Cancer. And for early detection, we implement technology to do early diagnosis, inclusive vaccination, HPV vaccination, and molecular oncology tests for preventions. Everything that meaning innovation and early detection, promote healthy lifestyles.
Right, so it's an overall, a big package really. What about the access to treatment? Because good cancer treatment is a way to keep people alive a lot longer, isn't it? What have you done there?
This plan is a comprehensive approach. We figure out the way to protect to the poor population through public insurance.
But it's costly, isn't it? It costs a lot of money.
Yes, but this plan is supported by the government. We have a special fund that is intangible funds that is protecting by law for the people.
How did you charm the money out of the government? Because they have many priorities.
It was a political decision in our country to afford this disease, and I think that the main issue is that a kind of budget that is budget by results, and we implement this model together with the Ministry of Economy, Ministry of Health, and our institute, National Cancer Institute.
Now, this is a fairly young initiative so far, but do you have any results? Can you say that you've been successful up to now?
Yes, we have more than 16 million people with primary prevention intervention. We have more than 2,500,000 persons with early detection interventions. We have many educational actions across the country, teaching to the different human resource, inclusive promoters, community. But the most important that we give access to the treatment, avoid the economical barriers to more than 100,000 patients with cancer. We give access free of charge to the treatment, chemotherapy, radiotherapy, and surgery. And the innovation in high technology is huge at the Institute, the best technology to access for everybody.
Right, so it seems from what you're saying that Peru is a shining example to the world. What I want to know is how will you be able to export that? You're here at an international meeting. How can you collaborate in partnership with other countries to do as well in other places?
This National Cancer Control Plan really is a result of a long-term process for doing collaboration. with different organizations. We are starting with NCI, US NCI, American Cancer Society initiative, and then we joined with different platforms in the global health action and scientific action networks. And that is the way we can learn each other to try to transfer knowledge, share information to improve our models in the world.
You sound very optimistic. What is the message you would leave cancer clinicians with in summary?
I think that we have to look for a world free of advanced cancer, and we have to get a comprehensive oncology approach for the population, for the patient, and for the families to protect to the people.